Welcome to The Game Changer with Dr. Sharalyn, where purpose meets performance and leaders are built to shift legacies. I'm Dr. Sharalyn Payne, executive strategist, speaker, and the secret weapon behind leaders who drive transformation at the highest levels. Each episode delivers bold truths, power skills, and real-world strategies to help you lead with precision, show up with presence, and build the kind of influence that outlasts trends. This is the space where high-impact decisions are born, where influence is intentional, and where the bold don't just lead, they change the game. So if you're ready to rise, ready to lead, and ready to create the kind of impact that moves markets, missions, and minds, you're in the right place. Today, we're joined by Donovan Pyle, CEO of Health Compass Consulting and author of Fixing Healthcare. He was named 2025 Benefits Advisor of the Year by the Validation Institute, and he's a thought leader helping mid-sized businesses save an average of $1,856 per employee annually. Donovan's insights are featured in Employee Benefit News, Benefits Pro, and SHRM, and he's here to share actionable strategies for your organization.
Dr. Sharalyn, it's so good to be here. Thanks for having me.
You're welcome. So glad to have you here. I'm excited to talk to you about it and what I think is something that impacts each and every one of us, especially people who are working in organizations. You reached out to me and I loved how you talked about how we can actually use benefits to create strong employee experience packages, as well as to help build economic opportunities. So why don't you share with us what you mean by that?
Sure. So, I mean, anyone who runs a business or has started a business knows that if you don't have the right people sitting in the right seats, you don't have a business, right? I mean, it's not going to go anywhere. It's going to be a disaster. Your customers are going to be upset. You're never going to sleep. And so getting the right talent is really the key to any successful business, even in the age of AI and all this stuff. You need good people. End the story. And so the question becomes, we've got all these baby boomers retiring. We've got a skills shortage in so many areas of business these days, in so many industries. And so the question becomes, well, how do you, as an employer, how do you compete for this talent? And so, what can you do to optimize your organization so that you have a strategic advantage in acquiring and retaining top talent?
So what do you think they can do? Give us some ideas.
Well, I mean, so my focus area is obviously in employer-sponsored healthcare, and just to level set for your audience, U.S. businesses cover 164 million Americans each year with healthcare benefits. Now, here's the opportunity, though. 25% of what we're spending in the employer channel is completely wasted. 25%. And if you break it down, that equals roughly $4,000 per employee per year in wasted profits. That is such an incredible opportunity. And this is really what I'm trying to raise some awareness around in the market.
I love that because one of the things that I've done in my experience, right, is really help organizations to strategize their culture. One of my favorite things has been creating, I would say, employee experiences. And so we're always looking for the budget dollars. What else can we do to bring to our employees, especially those organizations that don't have the budget to be able to say, okay, we're going to, pay above market. But what else can we do as a supplement for our employees? And so I've done some things like putting on 5Ks or employee wellness challenges or really building and fleshing out their well-being program. And we're always looking for the dollars. And so employees are asking for something more and they're not getting it. And quite honestly, one of the things I've seen is when we do the employee surveys, I would say, is that it always comes down to two things: comp and benefits. We're paying more, but we're getting less. The benefits program has changed. My friend is over here and they have this benefits and they don't pay anything, and and all of these things, right? And so it just becomes like this never ending battle that I've seen the leaders, especially at some of the organizations that have not been Fortune 100, organizations, they're struggling to figure out what else can I do? What can we do for our employees? and they're looking for their benefits leader or comp and ban to be able to answer that question. But from what I hear you saying, is that maybe perhaps there's some opportunity there. And so, why don't you share a little bit more with us about that?
100%. And so, if you're a mid-size or small business out here listening to the podcast, you have an amazing opportunity in front of you. And here's why. Most of your larger competitors, Fortune 1000 companies, they are asleep at the wheel when it comes to healthcare. Healthcare is also their second largest expense and also the fastest growing financial risk on their P&Ls as well, just like it probably is on yours. But here's the thing, you're at a mid-sized business, you're going to take the bull by the horns. You're going to say, you know what, enough with this waste, enough with these rising out of control, healthcare renewals every 12 months. We're going to build a strategy that allows us to optimize our program, not by squeezing benefits and shifting costs onto employees. No, we're going to do the opposite. We're going to save money. We're going to save around $4,000 per employee per year by improving benefits. I'm right here in Orlando, Florida, where a gentleman by the name of Harris Rosen became a pioneer in financing and procuring healthcare effectively for employees. He started his business, Rosen Hotels, in 1974. In 1991, he got upset. He fired his broker. He fired his health insurance company. He said, "This is ridiculous. I'm going to figure this out and do this my own way." Over the next 30 years, he pioneered techniques to provide a superior health plan for his employees at 50% below what his competitors pay. In fact, he saved his company over $500 million over the next 30 years, and by improving care and coverage for his employees.
Wow, that's amazing. That's spectacular.
Mhm.
I want to ask you a question with that. I know that you would be considered a whistleblower. Tell us a little bit more about that, and then I want to go somewhere else with that. So, how did you decide for those people who are listening and they're kind of struggling, right? Well, should I say something? Should I not say something?
Yeah.
Let's talk about that a little bit more.
Yeah, so I think it's, and one of the reasons I wrote my book was that I think it's important to understand the landscape. If you're an executive and you don't understand the healthcare and the health insurance landscape, you have almost no chance of making effective business decisions on how to
Mm.
manage your healthcare supply chain. And so, I started off on the insurer side of the employee benefits industry. Benefits brokers were my customers. Okay, so we would sell our products through benefits brokers. Brokers would sell them to employers. And, funny enough, sometimes we're so close to our own stories that we don't even realize it, right? It's hard to look at ourselves objectively. But when I was on the insurer side of the business, the biggest deal I ever closed with a broker, sure, we had competitive products, but the way that I closed the deal was that we were going to offer them the highest commissions for any product that they sold of ours, and we were going to take them on a luxury vacation if they hit a certain threshold of new business revenue. And so the thing is that as an employer, 81% of businesses use a benefits broker to help them maximize the return on their benefits investment. How do we get the most value for our money? And what most businesses don't realize is that brokers don't work for them. Brokers work for the carriers. They're simply distribution partners for health insurers. And they make more money when your costs go up, not down. And so they're not actually financially incentivized to do the number one thing you expect them to do. So, after learning about the work that Harris Rosen had done, I was confused. Why aren't more brokers recommending these kinds of strategies and solutions? I mean, I'd go to these open enrollment meetings, and the broker was just they would be catching heat from the employees. They'd be catching heat from the executives in some cases because the cost just kept on spiraling out of control.
Right.
And the narrative was always, well, healthcare costs just go up. There's not a whole lot we can do about it. But that's just categorically false. The first thing is you have to want to do something about it, and then you have to know how to do something about it. And that's why I wrote the book.
Awesome. So what advice though would you give to someone who's thinking about, becoming a whistleblower, shedding a light on something,
This was certainly nothing I ever pursued,
right?
consciously. I mean, absolutely not. After seeing that brokers were kind of apathetic about this challenge that employers were having, I said, I very naively thought, geez, if I just move from the carrier side to the brokerage side, I can probably start scaling these types of innovative strategies and solutions. I can probably help a lot of people and I can probably make some money doing it. And so when I went and worked for a national brokerage firm and built a book of business, I very quickly realized that's not the business that they're in whatsoever. They're in the business of just selling products. That's what they do. And helping employers maximize the return on their investment is a very, very different value proposition. And so I actually got terminated from that brokerage firm for helping our customers achieve their financial objectives. I was, quote, being too hard on the carrier who paid them their biggest bonus each year. And they didn't like that. And so that's when the light bulb went off for me and it said it's all about the financial incentives. And so I thought to myself, if I start a management consulting firm, I can align myself financially with the employer and give them unbiased advice, which, by the way, Dr. Sharalyn, is the first step in any company's healthcare transformation. You have to get unbiased advice. Not only is it the law, but it is the smart thing to do from a business perspective. When I explain the ludicrousy of the benefits industry to people, the analogy I love to use is that, you know, imagine if you were working with a CPA who got paid by the IRS. How much more in taxes would you end up spending every year? Right? You'd pay so much more in taxes especially if that CPA got paid a percentage of what you spent in taxes. Wow. That's a total misaligned incentive. You would never do that. But when it comes to our second largest expense, that's what 80% of businesses do because they just don't know any better. And that's why I wrote the book.
Wow, thank you for that. I want to go more into your personal journey. We're going to come back to that, but your personal journey of challenging that system, right? So you talk about being fired for doing the right thing, advocating for your clients, and
Mhm.
how that provides a narrative of conviction and the courage required to confront the way things have always been done, and that's what you've
Mhm.
done. And a lot of people want to do that. They don't have necessarily the courage or the support that's needed to do that. So, would you give them any advice if they're looking to blow the whistle? Not necessarily in benefits, but maybe perhaps it's something else. So, what advice would you give to them?
Well, be prepared for blowback. Legacy stakeholders inherently, they're not going to like that you're trying to call out their margins and put their business in jeopardy. And to be fair, it's not that I don't think these organizations serve a purpose. I think they absolutely do, but I think they need to be honest in their marketing about who they actually serve and why and what their value proposition is. You're not allowed to make fraudulent claims in marketing. And yet in the healthcare industry, it's just the wild, wild west. You can almost say whatever you want, and people just say, okay, I guess the marketing looks good. I guess I believe it. But just a note on that, on the transparency piece, starting in 2022, employers are required to have full disclosure from brokers. And the federal government didn't start that, didn't mandate that just because they thought it was a good idea, just random good idea. They understood that, the backdoor payments from carrier insurers and pharmacy benefit managers to brokers undermine their ability to give employers objective advice. So if you're someone who's sees a misalignment in the marketplace, something that just doesn't pass the smell test, and you have strong convictions about it, and you think it can be done better, then maybe you should pursue that. And I think you got to weigh the pros and cons though, because it's anything but easy. I'll tell you that.
Thank you. I appreciate that. And it is, challenging. I would say anytime you go up against the system, especially if you're a person, right, going up against the system, challenging the status quo, how things have always been done. Wise information you just share. You've got to be prepared for the blowback there. It doesn't mean that you have to be afraid. You just have to be aware that there will be some consequences and, for that. And so I appreciate you talking to us about transparency. And you mentioned that how ethical leadership can lead to profound improvements in both financial health as well as human well-being. Anything you want to add to that?
Yeah, I would just say, for executives listening to the pod here, many of you are fiduciaries on your health and welfare plans. Many of you are on this fiduciary committee for your 401k plans, and many of you are very proud of that, as you should be, because it is a big responsibility. What many of you don't realize is that you're actually, under federal law, required to have a committee for your health and welfare plans as well. And unlike so many things in the health and welfare space where, compliance is just a matter of checking the box, this is not, these fiduciary standards are not just exercises in compliance. It's actually very well thought out. I'll give the government credit here, that this fiduciary process of decision making and transparency and governance, this is done so that you don't waste money. You're talking about, your employees' money too. And right now, the average employer is wasting $4,000 in profits per employee per year. So I would encourage you, to first get with an independent advisor, a management consulting firm, or an ERISA attorney that specializes in the health and welfare space. You have to specialize in this. You can't have people that are just kind of dabble in this area because they don't know what they're doing. Trust me. And pick out who your fiduciaries are amongst your executive team, create that committee, and now you've got a formal way for making decisions. So many times, I'm sure you see this, Dr. Sharalyn, in organizations, the decision-making process is becoming more and more complex as we keep on
Absolutely.
adding stakeholders to
Mhm.
the decision-making process. In many organizations, it's become so elaborate, they don't even know who has a voice and who has a vote.
Right.
And that's problematic for not only them on the demand side, but also on the supply side too, because they don't know how to navigate, how do we, make a deal here, right? So this fiduciary process and these standards add real value. The cost of inertia and and no decision is in the millions for many organizations.
Thank you. So we have our takeaway, right? So we want to ask about this committee. Who's on the committee? What is the committee actually doing? I wonder if we were to go back and ask, tell me about this committee. Who's on it? How
Yeah.
often do they meet? What are they doing? What information would we get? And would then we be a target? But those are the type of questions we absolutely should be asking, especially when it comes to our benefits. So I appreciate that. Can you give our listeners a few key areas they should investigate within their own benefits programs right away, especially as we're coming up on open enrollment? What
Yeah.
is it that they should be looking for?
Okay. Well, the first step is, as I said, getting unbiased advice. Because if you're not getting unbiased advice, you're going to end up doing the same old things that everybody does that creates all of this waste. So that's a prerequisite. It's a non-negotiable. And then secondly, the second step in transformation is to quantify your current state. How are you performing in the 7 key categories of benefits value? And this is a novel idea. Most organizations have no KPIs for measuring the success of their benefits program. And so they don't know how to identify opportunities, they don't know how to set goals, and they don't know how to develop roadmaps because they don't have that framework for managing their program. So I would say, use an assessment. There's one on our website at fixinghealthcare.com or healthcompassconsulting.com. and it will score you into 7 key categories of benefits value. So that's the first step. Quantify where you are. From there, you can identify opportunities, set goals, and develop roadmaps to achieve them. Procurement is a very big deal in this space. Procuring the right, what I like to refer to as subcontractors, right? If your benefits advisor is your general contractor, to use an analogy, you're going to want to lean on them to help you find the best subcontractors to execute on your vision. So we call that procurement. That's the procurement phase. After procurement, you have implementation, and then you have management, and then optimization going forward. But those are the 6 separate steps of healthcare transformation. But it all starts with getting unbiased advice.
Perfect. Thank you for that. I believe you answered my next question, which was giving us a framework. So I won't ask you that. But in your experience, what are the biggest blind spots or areas of ignorance that executives often have regarding their employee healthcare
Mm.
benefits, and how can they overcome them?
It's such a good question. So there's a bunch of misconceptions in the market. And mind you, the legacy brokerage industry benefits from keeping you in the dark. And
Mm,
so here, one of the big misconceptions is that people think that healthcare is a single line item expense on their P&L. In fact, it is hundreds and hundreds of individual expenses that make up your healthcare supply chain that result in that one big monthly expense. And so, what you want to do is put yourself in a position over time where you can see more and more of your supply chain, and therefore that allows you to manage it, right? So, yes, get yourself in a position where you can see that supply chain. The other big takeaway and misconception that's out there is that, well, health insurers, they pay for all this stuff, right? The hospitalizations, the surgeries, the labs, the imaging, the drugs, they take on the risk, right? We just pay them a monthly amount and they take care of the rest. That is not reality. Health insurers have basically configured a system through the legislative process, et cetera, where they basically take on no risk. Okay. It is your business and your employees who take on this financial risk every month. Okay. And so if you're not figuring out ways to know how much you're spending on hospitalizations, surgeries, labs, imaging, and drugs,
mm,
and how to get the most value for your money in those categories of care, then you're really just rearranging the deck chairs on the Titanic. I mean, if you're not focused on those basic things, nothing else is really matters. You're going to be just treating the symptoms of the disease, not the disease itself. So you got to get down to basic supply chain management.
perfect. Thank you. I appreciate that. So, final question for you. If you could give executive listeners just one piece of advice for transforming their approach to healthcare benefits and reclaiming wasted dollars, what's that one key piece of advice you would actually give them?
Sure, sure. Okay, so people in my corner of the industry who are trying to help employers get the most value for their money,
Mhm.
um, we all like to say you need to get unbiased advice, right? Unconflicted advice. You need, to work with them. But employers don't really know how to do that. Well, you're telling us to do this thing. How do we go find it? Right?
Right.
So I'm gonna give everyone a shortcut here. So you don't have to read my book. Um, there's 2 ways. Basically, you can, if you have more than 1,000 employees, it probably makes sense to start bringing more high quality benefits expertise in-house. Hire a chief benefits officer, right? Create that position. And this way, they're not conflicted. They actually do work for you. You're their W-2 employee. Okay, so that's the first way to get unbiased advice. Now, but a lot of companies don't have that kind of scale and volume to really need a full-time employee in that position. And that's fine. So just like you might, hire a fractional CFO, you can work with a management consulting firm who specializes in this area. I'm not talking about McKinsey. I'm not talking about Deloitte. They only help the supply side. They don't really mess with the demand side. There's not enough money in it. Um, But there's a growing number of small management consulting firms who specialize in healthcare financing and procurement. And if you go to the Validation Institute's website, what they've done over there at the Validation Institute is actually scrub the contracts that these companies are using. And for ones that actually serve in a fiduciary capacity, which is a legal term, meaning that the management consultant must do what's in the best interest of the employer. That is a legal term. They have validated a bunch of firms and they list them on their website so that employers can actually identify these companies out in the wild.
Perfect. Thank you. We appreciate that. Now, I know I said one final question, but I do have a question. You mentioned the chief benefits officer. Would that be the same, just for some of our listeners here, as a total rewards person or a comp and ben, the head of compensation and benefits? Is that the same role?
It could be, and it's a great question. I would argue, though, if healthcare is such a unique challenge and requires such a specialized skill set that if your chief benefits officer is also in charge of global rewards, um, they're probably not going to have the bandwidth that they need to do it effectively. And so I think it's better siloing this off and having a real subject matter expert in that role, because the consequences of not having that expertise are, again, in the millions each year in lost profits.
And I thank you for that. I asked that question because that's exactly what I've heard as I've worked with benefits professionals or head of benefits or comp and ben or, SVPs, all of the roles, right, at the
Yeah.
highest levels in the organization that are responsible for benefits. And they say exactly what you just said. And the organization is frustrated or the employees are frustrated, but they just don't have the bandwidth to dive deep as they would. So something is going to be lost, even if they have a small team of professionals working for them. And often we see that they have one of the smallest teams in HR on that benefit side. And so we have to think about, what are we giving up when we have such a small team that is responsible for such a significant part of our lives. And so thank you for sharing that information with us.
Sure, sure. So Dr. Sharalyn, many executives don't know this, what they're up against. The medical industrial complex has a whole sub-industry called revenue cycle management. It's a $150 billion a year industry called RCM, revenue cycle management. They have their own conferences every year. In fact, they're meeting in Niagara Falls, I think next month. And the whole point of this industry is to extract as much money as possible out of organizations and patients through the practice of coding. Okay. When you're in a fee for service model, which most of you are, the way that the medical industrial complex makes more money is by upcoding as many codes as possible, providing more services than are necessary to your employees, which is actually harmful. And so this is again a $150 billion a year industry that exists they're working diligently every single day to figure out how to extract as much money out of you as possible. They hire the biggest consulting firms in the world, McKinsey, Deloitte, etc. They hire them to help them extract as much money as possible out of yourself.
Absolutely. That's so true. And it's interesting when they come into an organization and we have these high expectations of what they're going to do, and then what actually happens and the impact on that for the organization, the employees, and then also, society, right? So we're all brokering, selling, purchasing something. So I like that you share that information as well. You've given us a lot of concrete information and strategies, which I absolutely love. Everything from ethical and transparent leadership today to being a whistleblower to taking control of our benefits and, knowing what to look for, the questions to ask. I love the assessment that you've given. I want you to talk a little bit more about that. You have something for our listeners. And so I don't want to steal that from you, but I'll let you share about the free resource that you have for our listeners, especially those who are in executive leadership position, I encourage you to listen up and then go to the link immediately. Don't wait. Don't think,
Mm.
oh, I'll go to it tomorrow. This is important information because we're coming up again on open enrollment. And so you're in a position right now where you're brokering these deals, right? And you're putting together packages. And some people are still making those tweaks before October and November. And I've seen
Oh
them
yeah.
being made well into the ninth hour before it rolls out to change something, add something, take it away. But, Donovan, why don't you share with us what you have for our listeners today?
Sure. So I would encourage you to go to fixinghealthcare.com. And there we got a couple goodies for you. So the first one, you can sign up for a complimentary executive summary of my forthcoming book. And I know, most executives don't have time to read much, and myself included. So I thought it'd be a good idea to make a really comprehensive executive summary so that you can get the main takeaways of the book in several minutes. And from there, you'll be invited to take the free version of our total benefits assessment. In under 5 minutes, it's gonna ask you a series of questions, and you will get tailored feedback based on how your company is performing in the 7 key categories of benefits value. So you can actually have an idea of where the opportunities are within your program. You'll be benchmarked against hundreds of other companies who have taken the assessment. So it's a really valuable tool because I'm sure, like, for all the entrepreneurs on the call, having a good sense of direction is priceless, right? We can spend so much time and energy focusing on the wrong things, stepping over dollars to pick up pennies, and it is painful. So I just cringe when I see companies doing that each year. So I'd like to give you the gift of clarity.
Thank you for that. I appreciate that. I think that's an awesome tool. Again, you want to know where you stand. You want to be more strategic with your dollars and your actions. And so I encourage you to take the advice that Donovan has shared with us today. Go use the tool, read the summary, have some, I would like to say, some intelligent conversations about what's taking place. As a leader, you're responsible. You have a responsibility to the people that you lead, and you're impacting their day-to-day life. And so take advantage of today's episode and what Donovan has shared with us. Donovan, thank you for joining us on the Game Changer with Dr. Sharalyn, and hope to connect with you soon.
It's been a pleasure.
Absolutely. Thank you. You don't lead like everyone else, so your resources shouldn't look like everyone else's. I created the Game Changer Leadership Collection for high impact leaders like you, visionaries, change agents, decision makers who lead with intention and influence. This free high impact resource pulls from my leadership arsenal and delivers immediate actionable insights you can use right now to elevate your influence, lead with conviction, and drive lasting transformation. It's not just a toolkit, it's your first step toward leading at the level you were born for. Let me show you what's inside. The Leadership Edge Sampler. It's a preview of my 10 daily power skills to sharpen your influence and impact. The Influence Language Mini Guide. Essential phrases to increase your authority and build trust in every room you walk into. The Leadership Blind Spot Snapshot. Because the greatest risk are the ones we don't see. The power of one visual aid. A reminder that even one decision, one tone, or one conversation can shift a team or stall a movement. The Executive Briefing Checklist, a go to tool for high stakes communication that drives clarity and alignment. The 5 minute accountability brief, a no fluff framework to build a culture of ownership fast. And we have the Game Changer Ascension Model Overview, my proprietary leadership growth map to help you scale your influence with intention. These are the very same tools I use with executives, culture shapers, and elite teams, leaders who know what's at stake and aren't here to play small. Because when you're called to shift systems, influence nations, and build legacies, you can't afford to lead on autopilot. This is where your next level begins. Download the Game Changer Leadership Collection today. It's free, it's strategic, and it's built for leaders who are born to shift the game. I'm Dr. Sharalyn Payne, and this is your Leadership Edge. Thank you for joining me on The Game Changer with Dr. Sharalyn, where we don't follow trends, we set them, and we don't just lead teams, we shift legacies. If today's message challenged, stretched, or inspired you, don't keep it to yourself. Share it, tag it, lead through it, because real leaders don't just consume wisdom, they multiply it. Want to go deeper? Subscribe to the Ultra Influential newsletter for exclusive tools, behind-the-scenes strategy, and weekly mindset shifts for the leader ready to move nations, markets, and minds. Visit www.smpistrategies.com or send a note to leadership@smpistrategies.com. And if you're ready for next level coaching or consulting that positions you as the right leader at the right time in the right place, let's talk. This is what we do, and we do it with precision, power, and purpose. Remember, change isn't just something you lead, it's something you become. Stay bold, stay brilliant, stay a game changer.